Morning everyone, the Geezer here. Doing a short video today. I'm going to try and get it uploaded today. Today marks the 2-week countdown start for my ACDF surgery coming up at the Mayfield Clinic in Cincinnati. That stands for Anterior Cervical Discectomy and Fusion. And I'm not going to go into too much detail about surgery because there's plenty of videos online to talk about ACDF surgery and what it is and how they do it. And but there's a few people that did the process and how they healed. That's what I want to do. Let you know how I'm going along, because most of the videos on that seem to be older, and the technology's come a long ways now. The doctor says I just make a little 2-inch incision right in here, and they only have to cut one muscle. The rest of them they just pull apart, and the esophagus and airway and stuff, they just pull it out of the way until they get to the neck bones and take the disc out and put some slivers in there and bolt it together so it grows together, so the 3 will be a 1 in the end. So it is what it is. And they gave me a whole boatload of stuff for preparation. I got most of it done. I got the blood work done, got the EKG done. I go tomorrow to my family doctor to get physical, and then starting today starts various medicines you got to quit, and then I can't take any ibuprofen for like 4 or 5 months, a long time, because they told me ibuprofen can inhibit bone growth, and you want the 3 bones to grow into 1. So they said it'd take Tylenol. And then he said the surgery, I'm going to get it done at the Mayfield Clinic in Cincinnati. They got their own clinic where they do that, and it's same-day surgery. My appointment's at 10:30 or 10:30, my surgery time, and they said it takes about an hour and 20 minutes, and I go home, recover and go home. So my daughter's going to pick me up and bring me home, and I usually recover from surgeries pretty good. I don't have any issues with anesthesia and stuff like that. Generally speaking, my daughter picks me up, brings me home. We have make a little lunch of some kind, and then take a walk down the woods back. She says, "Okay, yeah, you're fine now. I'm going home." So away she goes. Don't have to stay all night with me, but the hospital thinks she does. So I don't anticipate any problems with this either. And they need to do the same thing to my lower back, and which is actually worse than my neck. But they can't do my back until they fix my neck. Got to fix my neck first, because he told me he wanted to do the surgery in February, and I stalled because I wanted to get some more wood put in the woodshed. So I got another full week to get wood in the woodshed for next winter. Although I'm not panicked because I got plenty. If I don't put another stick in here, I got enough to get through the winter. But he wanted to do it in February, so I talked him into waiting a while. And he said at the time, don't let anybody intubate me, because if they straighten my neck out to intubate me, it could paralyze me. So that was a chance I took. It worked out. So he's got to fix my neck, and then 6 to 8 weeks after that, if I recover goodly, then he can do my back. Whether they will do it in that time frame or make me wait, I don't know. But I want to get it all done this year, so then I'll be ready to get back in the woods next year. Because once I have the surgery the 21st, I'm pretty much done for the year. Because for quite some time, he said I can only lift 7 pounds or 5 pounds, whatever it is. Whatever a milk jug weighs. He said, jug of milk, that's the most you can lift. So, and it is what it is. So then if I get the back done right away, then you got that whole healing period too. So I figure I might as well get it all done in 1 year, get it over with, get healed up, back to the woods next year. So I feel pretty confident. I like the doctor, and that's all they do there at Mayfield, brains and spines. It's the Mayfield Brain and Spine Center, and they do surgeries at their center and at a couple of the big hospitals in Cincinnati. I told them I really wanted to do it at their center, because the big hospitals in Cincinnati are like hospitals everywhere. They got all kind of extra rules and craziness and stuff that you got to do that don't really affect you. At least by having it done over at the other place, they're kind of privately owned, and all they do is brains and spines. So any rules and procedures they got is going to be for my benefit, you know. And so I'm happy with them. My last 2 visits there was no more mask requirements for the stupid Chinese virus, so they got a sign on the door, mask optional, and nobody was wearing them. None of us old geezers there to see doctors, none of the doctors. So, but they did have a sign that says if you ask them to, they'd wear masks, but nobody was asking them to. Everybody's just glad to get away from them. So the deal is my neck and shoulders hurt pretty much all the time. Back really hurts when I get busy. And the doctors here, the lady who was treating me here told me last year when I was 73, when she got the MRI on my back, she says, man, you'd be a perfect candidate for back surgery if you was 53, but not at 73. I said, what? She says, no, you're too old. It won't work good for you. So I'm out in the woods every day cutting trees, hauling wood and stuff. I didn't buy it, so I talked to my family doctor, and he didn't especially buy it either. So he referred me to the Mayfield Clinic. The first thing the doctor there told me when he looked at my MRI, I took it on a CD to him. He pulled up, showed me, he says, man, he says, you're beyond medicine, you're beyond physical therapy. The only thing that's going to work for you is surgery, so we need to do it. And so while I was talking to the Mayfield people, the girl here was still working on my neck. It's giving me shots and stuff, and none of that junk was working. So she finally got an MRI, and when I went in the next time after she got the MRI, she says, man, there's nothing more I can do for you. Get your MRI on a CD, and next visit to Mayfield, give it to them. They can help you. I can't help you. It's beyond. So I took it to them, and they said, oh, holy smokes. We got to fix your neck first. Like your back, it's beyond physical therapy and stuff. So I was taking medicine for polymyxia rheumatica, but I quit it and nothing more happened. So I think for the last 20 years that I was being treated for that, really what I had was bad discs in my neck, and they was treating me for something else. You know, I think things happen, I guess. So we'll see after my surgeries. If all this pain goes away, then we'll know that's what it was. So at any rate, I'm going to try and post these videos now. We're on a 2-week countdown. 21st at 10:30 in the morning, I have my surgery. And I'm going to try and make a little video that day and every day or two after that for a week or two, just to let everybody know how I'm coming and how the surgery is, because the surgeries from 8-9 years ago are a lot different than they are now. So, and they just glued this incision together, and that's not a big deal. They give you some pain pills, heavy-duty pain pills. They said, but most people, he said, quit the pain pills the second day and just go to Tylenol. No ibuprofen, he says, and that's my favorite. But so I had my eye doctor appointment yesterday because I got some kind of degenerate thing going on there. And I asked, I said, when they fix my neck, do you suppose they're going to help this? And he said, probably not. He said, everybody's different. We'll see. He said, after you get your surgery, let me know how it goes, and then we'll see if you get better or worse or not at all. I said, okay. So maybe this and the back surgery will fix a lot of things. At any rate, I'll try and keep you posted. And I'll see if I can get my daughter maybe to make a couple of videos on the day she picks me up and stuff at the hospital and on the way back and things. And I can splice them together and do a little something. We'll see. Okay. Well, see ya.